Good morning, everyone, and good morning and welcome to the European Diploma in Radiology, the EDiR teaser. I'm going to go over the structure of the examination you are going to take in the near future. And this is going to be to help you on how is the structure organized in the exam and to help you on any questions or doubts you have about the examination. First, I'm going to explain you how is the structure of the examination. The first part are multiple response questions, and this is a computer-based examination. It takes approximately 90 minutes, not approximately, 90 minutes. So you will be able to respond these multiple response questions for 90 minutes. The second part is the short cases. This is again a computer-based examination. Also, it takes 90 minutes. You will have 90 minutes to go over these short cases. And the third part is what is called the clinically oriented reasoning evaluation. These are the core cases. These are practice-oriented cases. And again, this is a computer-based examination. The core cases replaced the oral examination in 2016. There is no anymore oral examination. The core cases you will be able to check on the computer, and there is no oral examination. So again, the structure includes the multiple response questions, the short cases, and clinical oriented reasoning evaluation cases. Each of the three parts are 90 minutes. You will have to respond to the multiple response questions, the short cases, and clinical and the core cases in 90 minutes. If you have any questions, please you can write down or type your questions, and I can answer while you are asking the questions during the presentation. So this the teaser examination that we are going to do today consists of the following parts. 9 multiple response questions covering abdominal, breast, interventional, musculoskeletal, neuroradiology, chest, and urogenital. 3 short cases covering breast, interventional radiology, and neuroradiology, and 1 core case covering breast. You have to take into account that it does not cover the entire blueprint. So in the exam, you will have questions from all the different sections in radiology, but this is just an example of how the exam is going to be when you take the final examination. You can access to the exam with your own device, opening these links using Google Chrome. And the core part will only work on a computer or on a laptop. So these are the links you can use to access to the exam. This is the multiple response question link, the short cases link, and the core cases link. Again, take into account that the core part will only work on a computer or in a laptop. So this is the first part, the multiple response questions or MRQs. So this is what you are going to see on the screen. These are the multiple response questions, and you will have to answer this question. In this case, for example, recognize the features, complications associated with Crohn's disease on CT, and you have to select between the different choices. Under the question, you can see that it says multiple answer might be correct. So that means that there is not only one answer correct, that there can be more than one answer correct. So in this case, I can select mesenteric lymphadenopathy, mesenteric abscess and fibrofatty proliferation of the mesentery. After I select the 3 correct answers that I consider in this question, I can save and proceed to the next question. So the next question is a question regarding breast pathology. And the question is on the upper part, we can see that it's a 45-year-old patient. And the question is, which of the following types of calcifications do you see on the images? Again, check under the question that there are multiple answers that might be correct. So that means that you have to select between the different answers the correct ones, and there can be more than one. In this case, I select the ones I consider that are correct. I save and proceed to the next case. For the multiple questions, you have 90 minutes. And here on the left part of the screen, you can check the time you have consumed answering the questions and how is the progress of your examination. So then if you have some doubts, you can proceed to the next questions, and in those cases, in those questions that you are not sure, you can go back and answer the question later on. And you have to always check on the time you have left to, or the time you have consumed to proceed during the examination. So I go save and proceed, and I go to the next case. And here, the computer tells me that I have already done 11% of the questions, and this is the time I have consumed during answering this 11% of the questions. So always check on the left part of the screen in order to be on time and finish all the questions after 90 minutes. So again, this is another question regarding Paget disease. Which of the following statements are correct? Again, multiple answers might be correct. So you have to select the answers you consider that are correct. And after you finish, you save and proceed to the next question. As you can see, here now the computer is telling me the progress of my answers and how much time I have consumed answering these questions. So always check on the left part of the screen. This is another question. Which conditions are associated with Marfan syndrome? Multiple answers might be correct. I select the answers I consider that are correct. I save and proceed. I have now spent like like 1/3 of the time to answer this 33% of the questions. So I'm doing like a good progress during the examination. And here on the left side, you can see the questions that you have already answered, and you can see that are lighted in green. So that means that you have completed that question. Those questions that you are not sure and you proceed and move to the next one, but you didn't complete, they will show in orange. So you can go back to the questions after you finish the ones you are sure. So in this case, regarding osteoid osteoma, which of the following statements are correct? Multiple answer might be correct. I select the ones I consider that are correct, and I save and proceed. If I don't want to save because I'm not sure about this answer, what I can do is I can skip and go to the next question. So this question will show up in orange on the left part of the screen, and I can always go back to this question after I finish the ones I'm sure about. So here which of the following tumors have a high tendency to be calcified. So here I have to select more than one answer, and I go to the correct answers, and I save and proceed. And here they are showing me some images. So if I go back to the prior questions, here you can see that are questions like without images, but here we can see a multiple response questions in which I can see some images. And they ask me what is the most likely diagnosis regarding these images. And I can select the answers I consider that are correct. If I'm not sure about that, I can clear the selection, and it will erase the selection I have done, and then I can select another one. And after I am sure about which answer is correct, I save and proceed. Here, you can see that there is only one option correct. So it's why if I check, for example, in a normal variant, and then I decided that this is not the right one, I clear the selection and I go to the right one. And then after I'm sure about which one is the right one, I save and proceed. Always check under the question if there are only one option correct or there are more than one option. And this is just radiography in a 24-year-old female. And they asked me about the differential diagnosis. There are multiple answers correct in this image. So I can select the ones I consider that are correct. If I made a mistake and I selected by error one of the options and I want to erase the selection, I can clear always the selection. And after I am sure that the answers I have selected are the correct ones, I can save and proceed to the next image. If I'm not sure, again, I can skip this question and go to the other one without answering. And I can go back to these questions after I finish the ones I am sure. And again, the ones I didn't answer, they will show on the screen in orange. And the ones I have answered and saved, they will appear with the green button. And again, here I can see the time I have left to do the examination. And this is the progress. I have already done 78% of the questions. And this is the time I have left to do the rest of the questions. Here is 7 out of 9 questions. So I have 3 minutes and 20 seconds to do the next 2 cases or questions. So this is another question. And which of the following statements are correct regarding these images? So these are multiple answers might be correct. I can select the ones I consider that are correct. If I'm not sure, again, I can clear this selection and select the correct ones. And then after I am sure about the correct selections, I save and proceed. So are there any questions regarding the multiple response questions? Okay, if you don't have any questions about the MRQs, sorry,
Professor
yes?
Oleaga, there's a question. Do you want me to read it, or if you go to the question?
No, now I can see. Yeah, I can see now. I was checking, but I didn't see it. But now I can see it.
Okay, perfect.
But this is very, okay. Okay, I have a question about MRQs. There are some questions because I couldn't see it on the screen, but now I am seeing. I have a question about MRQ. If you skip question, making some selection of answers before and after you back to an answer question, the previous selection of makings will be erased or saved in that question. That I'm not sure. I believe it gets erased, but I don't know. Cristina or Vanessa, can you answer this question?
Yes.
If you
in order to skip the questions, you have to unselect all the answers, because if not, the answer will be saved and you cannot change it anymore. So you have to remove all the selections in your answers and then skip the question.
Okay, but you have to unselect it. So if you go to skip and you did not unselect the answers, the system will consider this question as safe.
Yes.
Okay. Regarding the second question, if I answer a wrong question, do I lose points? I will go over this information after we finish with the other part, because this is a general information, and I will go over this information after I finish with the short cases and the core cases. Okay, so now we can move to the short cases. So this is how you are going to see the short cases. You are going to get the clinical information of the patient and the images you have to check. And so this is, for example, a case of a 47-year-old obese man with mildly tender lump near the right nipple, and the mammography was obtained, and there are 4 images of the same series. So over here you can zoom it, zoom the images if you want to check on a certain area, and you can check the clinical information and the images. After you check on the clinical information and the images, you can proceed to the next, to the question itself, to the first question. And here in the first question, they tell you to indicate the abnormality. You have to click at the center of the area you consider that is pathologic. If I click at the center of the image, here is the abnormality, and I have to check or select the center of the abnormality. If I click on the border, so the system will consider this apart from the abnormality, and the answer will be wrong. So you have to click at the center of the abnormality. If you like initially click on an area that is not at the center, you can always remove the indication before continuing and saving the area that you consider that is abnormal. So again, here you can zoom the image in order to better check the abnormality. Again, here you can see the progress and the time you have consumed during doing this case. So you have selected the abnormality, you have clicked on the area you consider that is pathological, and now you have to answer some questions regarding this abnormality you have seen on the images. The first one is, which of the following statements best characterize the finding? Again, here you can see that there are multiple answers that can be correct. So you have to select on the answers that you consider that are correct. In this case, oh, sorry. In this case, I have selected this. If I I'm not sure, I can clear the selection and check, sorry. If I'm not sure, I can clear the selection before proceeding to the next question. If I want to skip it, I can skip. In this case, you cannot skip the answer. You have to continue to the next image. I think this is correct, no, Vanessa? Because all the questions here are related to the short case. So here, give the most likely diagnosis of the abnormality in the breast. Here, only one option is correct. I can check on the option I consider that is correct. If I'm not sure, I can clear the selection and select another one and proceed to the next question. So this is one short case, and you have the clinical information and 3 questions regarding this case. So here you cannot skip and go backward. So you have to continue following the structure of the short case with the clinical information, first question, second and third question.
Yes, you can always skip the whole case if you want, but not the questions inside the case.
Yeah. Mm-hmm. Yeah, you can always skip the case. I mean, like if you check the first the information, the clinical information, you can skip and go to the next case. But once you have started answering the first question, you have to continue and proceed to the second and the third question.
Well, you can answer question 1, for instance, and if you go to question 2 and you don't know this question and you want to leave it by the end of the exam, then you can skip it and you will go to short case number 2. But what you cannot do is to go to question 3 without answering question 2 in the first short case.
Okay. So this is another case. This is the 46-year-old woman. And here you have all the clinical information and you have an image, and you can check on the image, you can zoom it and go over the image. And after you have all the clinical information and the findings you have seen on the image, you can proceed to answer the questions. So here you have to indicate the abnormality, and you have to select the abnormality and click at the center of the abnormality. If you made a mistake, you can always remove this indication and go back again and select the center of the abnormality. And so then you can save and proceed. And here, this is the second question. The angiographic findings include, and here there are multiple answers that might be correct. Here you can select the answers you consider that are correct. If you are not sure or if you made a mistake, again, you can clear the selection and go to other answers, and you can save and proceed, or as Vanessa was saying, you can skip and go to the question 2. But you cannot go to question 3 unless you have answered question 1 and 2. And so if here this is your answer, and here you have to write or type the most likely diagnosis in this case. Please do not use more than 5 words. Don't worry about the spelling or because you can check the spelling here, but the dictionary doesn't include all the words, so ignore the spelling on because these questions are going to be checked by the examiners, and we are not going to take into the account the misspelling of the words. And please don't use more than 5 words, and don't worry about the spelling, because we know that we all are not English native speakers, and so we know that there can be some misspelling, and the dictionary doesn't include all the possible words. So don't worry about that, and don't spend time on trying to spell it correctly. Here you can save and proceed and go to the next case. As Vanessa was saying, that here you can skip and go to the last questions, but you cannot go directly from question 1 to question 4. You have to answer first question 3 before going to question 4. So what course of action would you take next? So here there can be multiple answers that can be correct. And so here I can select the multiple answers. Sorry. And save and proceed. This is another case. This is a 68-year-old male with seizures. And here you can see the images, the MR images that are shown in this case. You can analyze and spend the time you need on evaluating the pathology. You can zoom the images, but again, you have to check on the time you have consumed answering these cases in order to speed up, or in case you didn't progress correctly. And here you have to indicate the abnormality. You have to click at the center of the pathological area, and you can save and proceed after you select the abnormality. And here they ask for the differential diagnosis, and you can click on the answers you consider that are most likely. There can be more than one answer. If you are not sure, again, you can clear the selection and select other answers. And then you can save and go for the answer, give the most likely diagnosis in this case. Please do not use more than 5 words. And here is your answer. And if you made a mistake or you want to correct it, you can always clear the selection and type another answer. You can check on the spelling, but don't worry about the spelling. And here in the short cases, usually you have images. They ask you to select the abnormality. After you have to make a decision on the differential diagnosis. Finally, they ask you for the final diagnosis, and then what is how you are going to proceed with this case. What other things you consider have to be done in this case. For example, in this case, what course of action would you take in this case? You have selected the abnormality. You consider that can be cavernous malformation. So you have to decide now what is your next, how you are going to treat this patient. In this case, we decided that the best procedure to do in this patient would be radiosurgery or surgery. So we don't consider that this patient needs a biopsy or no further action. So after you select the correct one, you save and proceed. So in the short cases, you have images, you have to select the abnormality, you have to select between the different possibilities of differential diagnosis, you have to make the diagnosis, and afterwards you have to make a decision on how to proceed on this case further. Okay, now I'm going to check No, you cannot use, there is a question about using a dictionary during the examination. A dictionary is not allowed during the examination. You cannot use any material. Vanessa, can you explain exactly how to skip in the short cases from question 1 if so you cannot go to the last question without answering the previous ones, but can you exactly explain how it works, Vanessa, please?
Yes. Inside a short case is, well, it's the same as in the MRQs. So if you want to skip a case, if you are in the clinical data or in question 1 or in question 2, just leave the answer in blank. Don't select any answer and don't type in any answer. And just click on skip button or in the save and proceed, and you will automatically go to the next short case. The system will warn you that you have to skip the case, so you will be informed about everything in every stage. And in the table of contents, you will see that you have unanswered questions that are highlighted in orange. So you will be able to come back to these unanswered questions anytime as long as you have time left.
So only if you have this is, I don't know, I have to ask Vanessa as well. If you save the first question, if you go to the second one, you have to skip the second, you have to delete the answer in the second one in order to skip the case.
Exactly, but the questions that you have already saved, this will be kept saved, so you don't have to answer them again.
Okay, but this is only possible if you only answer questions question 1 and 2. You cannot go further. If you go further, you cannot skip the case.
Well, you can skip the case at any time. I mean, what you cannot do is to move forward inside a case without answering the previous questions. I mean, you cannot go to the last question of the case without answering the previous one, because there's a reason why, is that sometimes inside a case, the last questions can give you hints about the diagnosis or the findings of the case. That is why you have to answer the questions sequentially before going to the last questions. But you can always skip the case in any question inside the case.
Okay, so that now is clear. So you can skip anytime during the questions, but you can not move to question 3 unless you have answered question 1 and question 2, and you cannot go to question 4 unless you have answered question 1, 2, and 3.
Yes.
Okay. Yeah, and there is another question. Is an answer definitive when you save it? So when you have any doubt, better to skip them. Yes, if an answer is saved, you can is definitely saved, and you cannot remove that answer. So in case you have any doubts, it's better to skip that question. So there are no any other questions. So now we can move to the next part, that are the clinically oriented reasoning evaluation. These are the core cases. In the core cases, you are going to be shown cases in the computer as if you were reading a case in your practice in the hospital, and you will see the case like in this core case. This is a you will get some clinical information about the patient as you get in your clinical practice. And this case is a 59-year-old male with dyspnea. And you will see a chest X-ray. And you can always zoom it. And in the court cases, you are going to be like if you were in your computer, and you can go through the case as if you were in the computer. You can zoom it, and after you see the image, you can proceed and move to the questions. And here, this is again a free text, and you have to list the most relevant abnormalities you can see on the images. Here you have to take into account, you have to always read exactly how is the question written, because here they ask for the relevant negative findings. So always read the question, because maybe in this case you can think that if you don't read the complete sentence, you will think that you have to list the positive or the abnormalities you are seeing on this image. So here you have to list the abnormalities and also the relevant negative findings regarding this case. What is important that you don't see on this image, and that is important to make the diagnosis. So always check on the sentence, because otherwise, if you only read the first part, you can have a wrong answer. Here you can see like bilateral lung nodules on various sides, areas of confluent density in the upper zones, calcifications with confluent areas, right pneumothorax. What is important here, there is no pleural effusion. So this is important also for the diagnosis of this case, and this is what is asked, like relevant negative findings on this case. Again, you can use the spelling check here, but don't spend much time on checking the spelling, because this is not going to be important. The examiners are not going to take into account spelling like wrong spelling. So here, now, after you have seen the chest X-ray, you have here a CT of the chest, and you have the axial plane with lung windows and the coronal plane with a soft tissue window. And here you can see the bar. There are like 117 images, and you can scroll on the bar as if you were in your computer and go over the complete case. And here again, in the coronal reconstruction, there are 123 images, and you can scroll on the case and go over all images. And after you have seen all the images on the axial plane and the coronal plane, here you can list the significant abnormalities. And here you can type, this is a free text, and list the significant abnormalities. Again, in these cases, since there are many images, always check on the time you have consumed evaluating the case, and check the progress on your examination. Otherwise, you can be like spending too much time in one case and then not have enough time to go over the other cases. So after you review the images, you can answer here and list the significant abnormalities. And here, after you list the significant abnormalities and you are happy with what you have written, you can save and proceed and go to the next question. In this case, what is the most likely diagnosis? Here, check that there is only one option correct. And after you decide in between the different possibilities which one is the correct one, you can select the answer you consider that is correct, and always you can erase if you are not happy with the first selection, and proceed to the next question. So are there any questions regarding the core case? Okay, so now we are going to answer like some like important questions about answering a wrong question if we lose points or not. So I'm going to go over the 10 tips to succeed in the EDiR diploma. So again, I have already told you that you have to check under the question if there are only one answer correct or multiple answers that might be correct. So this is important, and you have there can be from 1 to 4 correct answers. So if there are multiple answers that might be correct, this can be from 1 to 4 correct answers. So always check on under the statement of the question. And the scoring of the questions, when there are multiple answers that might be correct, the scoring is proportional. There are not negative scoring. So this is the number of correct answers selected by the candidate. This is the total number of correct answers. These are the number of incorrect answers selected by the candidate, and the total incorrect answers. And this is the formula like we use to score the questions when there are multiple answer questions. So this is proportional. There are no negative marking. And the minimum score is 0. When there is only one option correct, the scoring is 0 or 1. If the candidate makes the correct selection, the scoring is 1. If the candidate selects the wrong answer, the scoring is 0. There are no negative scoring. So again, there is no negative marking, and the minimum score of one question is always 0. So don't worry about the negative marking. And again, if there are multiple answers possible, there is this formula to make the scoring, but the minimum is always 0. There are no negative points. As I was explaining during the presentation, you can always check your spelling in the free text questions by using this spelling checker. But again, please do not spend time, don't waste time doing the spelling, because the examiners will go over the answers, and we know that there can be some misspellings, and we are not going to consider that as an incorrect answer. So please don't spend too much time checking your spelling. And again, I was already explaining during the presentation that you always have to check on the progress of your examination on the left part of the screen, and the time you have left and the time you have consumed answering the different questions. And on the left side, you can see also the table of contents. So the ones, the green bullets mean that you have already saved and answered this question, and in orange, you have the ones that you didn't answer yet. So here you can also see the progress of your examination, and then check your time and the time you have left to answer the rest of the questions and to complete the examination on time. In the core cases, this is you have a viewer, and as I show you during the presentation, you can, if there is a CT examination or an MR examination, you can always scroll on the different images. But if there is a plain film, you can always change the window, zoom, and you have tools, and you can do it manually, the windowing. So you have all these tools as a regular viewer to check the case and to go over the images. This is like a regular viewer as you are doing during your clinical practice. So there are like presets in the windowing, but you can always do it manually. And when you are answering the free text, please here, for example, describe the CT findings. Try to use a few words, not a lot of words. Like specify exactly what you are saying, and don't worry about the spelling or the English. Just like specify in a short sentence with a small amount of, with a few words, exactly what you are seeing on the image. So you don't have to construct like sentences. Just say enhancing wall, mask containing fat density and calcification, or heterogeneous anterior mediastinal mass. Don't try to be very like doing a literature sentence. Just be like specify exactly what you are seeing on the images and concentrate on the pathology you are describing. And so in these cases, these are clinical cases, as if you were doing a case or reading a case in your clinical practice. So this is a test to check your knowledge and the way you are reasoning regarding this case. So you have to give logical answers. So this is not, these are clinical cases, regular clinical cases, and they don't have anything strange on the cases. Our regular cases, we try to check on your knowledge and how you reason and how you proceed when you are reading those cases. And again, if you have any doubts or during the examination, and in some questions, if you are not sure about the question, please don't waste your time and move to another case. You can always go back to that case later on. And in those questions that you are not sure, it's better to proceed and go to the next one and go back again, because if you waste too much time in questions that you are not sure, then you are not going to have time to finish the examination. And there are some questions that probably you knew how to answer, like straight ahead. It would be then you will lose time, and you won't have time to do those questions. So if you have any doubt, like skip that question and move to the next one or to the next case, in order not to lose time during the examination. And if you are interested in any further information, you can go to the web page of the EDiR, or you can contact the team of the diploma if you have any further questions. But in the webpage of the EDiR, you can get all this information as well. And okay. So in the open questions, there is a question that if you don't finish all the cases in a section, there is one question about not finishing the cases. So this is like the scoring system. Maybe Vanessa, you can explain how is the final scoring system, and if you don't answer a case, so this would penalize your scoring. So you have to, it's better to finish all the cases. Vanessa, maybe you can add some information about this scoring and what happens if you don't answer one of the cases.
Yes, in the first two sections, in the MRQ section and the short cases, you will not be penalized. I mean, if you don't answer a question, it will score as a 0. But Professor Oleaga already said that we don't have negative marking. So you won't be penalized with negative marking, but just this question will count as a 0. And in the course section, we have the same procedure. This means that the cases that you don't complete will count as a 0, but we require that at least 8 cases have to be completed. And regarding the scoring, in order to have the EDiR certificate, you have to pass both sections of the exam. So you have to pass the MRQs and short cases, and you also have to pass the course section. If you fail any of these two sections, then you will be automatically failed in the exam.
Yeah, and as Vanessa was saying, in the core cases, it is important to finish at least a minimum of 8 cases in order to pass that core cases part. So it's why if you have any problems with one case and you are not sure, it's better to proceed to the next one, because you have to finish at least 8 cases. And in the other areas, in the written and in the MRQs and the short cases, I mean, like if you don't finish some questions, you will get a 0 as a score. So this will penalize the final scoring. Regarding the other question, is a limited items to write in the open questions? No, there are no limited items to write, and you can write what you consider is important in that case. But again, you have to be like concentrated and in the case and specify what you are seeing in with short sentences and with a few words. Can you go back to the first slide where the teaser examination links are displayed? Yeah, I will go to the first. Okay.
You also have these links in our website, in the My EDiR website. You will also find these links in a section that there is some material to help you preparing the exam.
Some links are displayed. Okay. So this is so you, as Vanessa was saying, you can always go to the website, but these are the links you can check on the this. If you go to EDiR to the EDiR webpage, you can see these links, but I can show you here. Okay. Vanessa, I don't know if you answered this question. What is the limit value for passing the MRQs?
Well, the pass mark is calculating depending on each exam, but in general, the pass mark is in the first section because the MRQs and the short cases go together. The MRQs have a weight of 70% and the short cases have a weight of 30%. And in total, usually the pass mark is around 52%, 53%.
So there is another question again. How many questions can you fail and still pass the exam? Not only the MRQs, all the exam. And this is what Vanessa was saying, that the scoring also depends on each examination. And the pass mark is around 52%, as Vanessa was saying. So the pass mark depends on the examination, each examination. Vanessa, can you repeat again the percentage of the...
Yes, for the first part is around 52%, the pass mark, and for the core part is around, it's a bit higher, maybe around 55%, 60%, depending on the exam.
And again, in the core cases, you have to answer a minimum of 8 cases. So the percentage of, Vanessa, the percentage of the scoring, 70% is the short cases. And can you repeat that percentage of what represents in the final scoring, the MRQs, the short cases and core cases for the total percentage?
Yes, we have 2 parts in the exam. First part is formed by 2 parts, subparts. So it's the MRQs, which is a 70%, and the short cases, which is a 30%. So we make this calculation, and the total score of this is the first part. And the second part is the core section. And these both parts have the same weight in the exam. So this means that you have to pass the first part, multiple response questions and short cases, the total score of this, and the core section.
And there is another question. All areas of radiology are equally questioned. No, there is a blueprint, and this information you can get on the web page also. So this means that there are areas that are there are more questions from certain areas, for example, abdomen or neuro radiology. There are more cases of abdomen or neuroradiology and less cases of pediatrics or cardiac imaging. So this information is in the web page of the EDiR, and depending on this is a reflection of what is on clinical work. And so in clinical work, we have more abdominal or cases than or neuro cases than pediatrics. So there are more questions on abdomen than on pediatrics, or more questions on chest than, for example, on interventional radiology. So the different sections are weighted depending on how it works in the clinical practice. Vanessa, the blueprint is in the webpage of the EDiR.
I will check with the administrator of the website because I'm not sure. But I would like to add something in this regard, because I see that there are a lot of questions about the scoring. You will find also all this information in the terms and conditions. So I would advise you to read them before the exam, because all this information is in there.
Are there any other questions, or? For example, there are going to be like some questions also related to safety or management, but there are going to be only one question regarding these areas. So the main areas are going to be like the main areas we are used to work on the clinical practice: abdomen, neuro, and like musculoskeletal. So depending on the sections. Mm-hmm. Regarding when, how long does it take, Vanessa, to get all the results of the examination? I'm not sure if it's in how long time do we send them the results?
In around 2 weeks.
In 2 weeks. Okay. In 2 weeks, you will get the results. So, Mohamed, what do you need? There is another question. Will be questions about nuclear medicine? Yes, there are questions about nuclear medicine, but this is not the main part of the examination. There are some questions regarding PET-CT and associated to some of the cases or the MRQs. There is one of the attendants that wants to go to the first part of the presentation. What part of the presentation did you miss? I mean, like the exam, Vanessa, all the information regarding the location of the examination, the documents they have to provide or get to the examination place. This is all this is, I guess, in the information.
Well, you should have received this information already into your email, but in any case, you can send an email to diploma@myedr.org and ask to resend this information to you. And regarding the attendee that missed the first part of the presentation, and maybe if Professor Oleaga wants, we can upload the video of the webinar into the website so that everybody can see the video.
Yeah, I think this is better. Like since we have recorded the video, we can upload it in the web page, and you can go over this video, and you can check the part you have missed. And there is another question: that are the results of the EDiR strictly confidential? Yes, this is strictly confidential. That we don't send this information to anybody, and nobody knows the results except the group of examiners that we go over the cases, but this is strictly confidential. But even the examiners, we don't know the final results of each candidate. We review the exams, but then in the office they check the scoring, and this is strictly confidential, and all this information is in the office, and only those cases that are we have to discuss because the scoring is in the limit. In those cases, the examiners will go over this examination all together. But except from that, everything is confidential and is done. The scoring is done in the office. Regarding the time and the examination, I guess you receive all this information when you apply for the examination, and all this is going to be in as Vanessa was saying, in the information they send you.
Yes, usually the registration, it doesn't take very long. So once all candidates have been registered, we will start the exam. So it won't take too long. So maybe we will start at 9:30 the exam or something like this.
Okay. If there are no any other questions, as Vanessa was saying, you can check on the webpage of the EDiR all the links and also the video with that is going to be uploaded with all the information. And I hope this EDiR exam was useful for you, and I wish you good luck in the examination. And regarding this last question, that if there is a safe place to leave any small luggage in the place of examination, I don't know, Vanessa, this is something, this information is also in the information sheet you have sent all the candidates?
I'm not sure, but in any case, you can take your bag into the room and put it at the back, or we will manage this during the exam. Don't worry.
Okay, so then, so we can thank you again, and I hope again that this has been useful for you, and I wish you like good luck during the examination. And any doubts of any questions you have, you can send to the office. And during the 2 days of the examination here in Barcelona, we will be there during the exam in order to answer any doubts or questions you have during the examination. So we will be around there and helping you with if you have any problems with the computer, or if you have any doubts about the cases or whatever, any questions. So all the people from the office are going to be there, but also radiologists. We are going to be some radiologists there, like helping you if there are any questions regarding the cases you are going over. And I wish you like a good luck during the examination.